In prostate cancer today, there have been a lot of advances in the last few years regarding the detection of this disease, and it's really important because it dovetails into how we treat it. Nowadays, we're using a lot of MRI to diagnose localized prostate cancer, and the detection of prostate cancer through MRI fusion biopsy has really changed the landscape in prostate cancer. We still today do our core biopsies around the entire gland, but our hope is in the future we'll do less and less of that. So we'll detect less of these low-grade cancers that are probably clinically less significant and really focus on the image-guided tumors that may be sort of more lethal in the future. So I think the role of MRI, in particular MRI fusion biopsy, is rapidly evolved, has now become a new standard of care for the detection of prostate cancer. I think the other thing that's really changed in prostate cancer is this, believe it or not, concept of active surveillance and the use of no treatment for these low-grade cancers. And as we get more and more comfortable with our curative approaches with radiation and hormonal therapies or surgeries, we may be more emboldened in the future to observe patients with localized prostate cancer. And then finally, in advanced disease, I think there's been a lot of breakthroughs now with secondary hormonal therapies, with chemotherapies, with radiation pharmaceuticals like radium-223. Probably the next generation of therapies for advanced prostate cancer are going to be molecularly targeted, genetically defined advances, like with PARP inhibitors for DNA damage repair defects. It's incumbent on us as clinicians to check patients with metastatic prostate cancer for somatic and germline alterations, genetic alterations. So that's probably the other piece that's rapidly evolving in the field.